And today I'm giving you 5 tips on how to get off high blood pressure medications safely. Let me ask you this. Are you tired of taking your high blood pressure pills every single day? Do you sometimes ask yourself, is it even possible for me to get off of these medications for good? Well, for many people, the answer is yes. We know that high blood pressure is a leading cause of heart disease, strokes, and it's actually the number 2 cause of kidney failure. Yes, it's the number 2 reason why I take care of patients in my dialysis unit. We also know that while high blood pressure medications can be very effective in lowering blood pressure, they can also sometimes have some undesirable side effects, right? And so we're trying to find that balance. Number 1, consistent, moderate exercise. According to the American Heart Association, it is recommended that most adults get 150 minutes of moderate exercise per week. And so that averages to about 30 minutes, 5 days a week. And the exercise does not have to be super complicated, super complex. We know that when you exercise, that helps to release endorphins, it helps to decrease stress, and that's good for your blood pressure. It also helps you to maintain a healthy weight. And if you are a person who is living with a healthy weight, and if you're not living with obesity, then you're more likely to have a lower, healthier blood pressure. Also, consistent exercise helps you to have a stronger, healthier heart, and that can help to decrease the pressure in your vessels. So here are some simple ideas for exercise. Walking. Yes, a brisk walk. See if you can work in a 30-minute walk at least 5 days a week. And if you want some variety, incorporate the exercise throughout your day. For example, take the stairs instead of taking the elevator. When you go to the grocery store, park in a far parking space, and so you have to walk and get exercise on your way in. You can also take it and make it a family event. Go on a bike ride with your family. Have a dance party in your living room. Go ahead and check out some yoga and Tai Chi videos. If you have access to a gym, look and find a variety of exercises, strength training, try some different machines. You can also do some simple isometric exercises. In fact, isometric exercises have been found in studies to be one of the most effective ways to lower your blood pressure. By isometric exercises, I mean doing planks, wall sits, squats. Just make sure you find a way to incorporate exercise into your everyday life, because that is one way that could allow you to get off some high blood pressure medications. Question: what is your favorite way to fit exercise into your busy week? Please share tips down below. Number 2, drastically reduce your sodium intake. Yes, I'm sure you've heard that having a high salt diet is not good for you, but the thing is that a lot of the salt in your foods, it can be hidden salt. So many of you may be listening and you might be thinking, I don't add salt to my food, or I just use pink Himalayan salt or sea salt. Remember, sodium is sodium. So even if you're a person who uses pink salt, if you think you're using a salt that's healthier, and I will say that Himalayan salt does have some minerals to give it a different type of a health benefit, but it still has sodium. And so you need to watch the label and limit any kind of salt that you're taking in. According to the American Heart Association, it is recommended that most adults have less than 1,500 milligrams of sodium or salt per day. That might seem like a lot of salt, but it's not. If you think about this in terms of teaspoons, 1/4 of a teaspoon of salt is anywhere from 560 to 590 milligrams of sodium. And so even if you have 3/4 of a teaspoon of salt a day, you've already exceeded the daily recommended limit. So here's the real key. Make sure that you're a label watcher. And even in foods that you think might be healthy, sometimes there's hidden salt. For example, in canned foods, even if it's canned vegetables, they can be high in sodium. Frozen dinners. I know a lot of you like those frozen dinners that are lean, that are supposed to be low in calories, that are low in calories. But a lot of these frozen dinners are high in sodium. Of course, you know that fried foods and chips and French fries and all those things are high in salt. But what about condiments? Yeah, you got to watch the salt in ketchup and definitely in soy sauce. My point is that it is important not just to dodge the obvious sources of salt, but make sure you're aware of that hidden sodium. And pulling back from that hidden sodium can help you to get off some of these high blood pressure medications. Here's the mechanism of how a high salt diet can cause you to be on high blood pressure medications. When you take in salt and that salt is inside of your blood vessels, then water follows the salt. And so you get excess water in those blood vessels. What happens when you have a high amount of water inside of blood vessels? Well, it pushes against the walls and increases the pressure inside of those blood vessels, leading to high blood pressure. And so if you want to come off of some of those high blood pressure medications, you definitely want to drastically reduce your sodium intake. Be sure to watch my video on 7 low sodium foods to help combat high blood pressure after you finish watching this video. Question: what is one simple, healthy food swap you have made that you now love? Please comment down below. Number 3, significantly limit your alcohol use. No, I don't want to be a fun snatcher, but I'm here to tell you the truth on how to get off of some of those high blood pressure medications. We know that excessive alcohol use can be linked to an increased high blood pressure. Even when you're using the alcohol, it can cause a temporary, but sometimes significant spike in your blood pressure. And if you have a chronic use of alcohol, especially an excessive chronic overuse of alcohol, it can definitely lead to high blood pressure. And so, yes, limiting the alcohol will be a great way to get off some of these high blood pressure medications. Now, I have to say that studies now show us that there is no recommended amount of alcohol. There's no officially safe amount of alcohol. But I will share some previous CDC recommendations on what was considered to be the upper limit of alcohol. No more than 1 drink a day for a woman, no more than 2 drinks a day for a man. And remember, you must know the definition of a drink. If I ask some of my patients, my male patients, hey, how much do you drink? They'll say, oh, I have 1 drink a day. But they might be talking about having a 16-ounce tumbler of dark liquor. That is not 1 drink. Here is a definition of a drink: 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of a more potent, stronger alcohol, like an 80 proof liquor, okay? Each of those is considered to be 1 drink. And so consult with your doctor because, again, there is no official recommended safe amount of alcohol, but I do know, and I can tell you, that when it comes to your health, the less alcohol, the better, especially if you're trying to get off of blood pressure medications.